ஆதித்யாயனாக பிரிக்கப்பட்டுள்ளன. அதில் ஒன்று தெற்காசிய சுகாதார இலங்கை இந்த தெற்காசிய பிராந்தியத்தில் உள்ளது 10 நாடுகள் உள்ளன. இதில் 78வது பிராந்திய மாநாடு கொழும்பிலே அக்டோபர் மாதம் 13ஆம் தேதியிலிருந்து 15ஆம் தேதி வரை நடைபெற உள்ளது. இந்த மாநாட்டிலே இந்த 9 நாடுகளின் அமைச்சர்கள், சுகாதார அமைப்பின் செயலாளர்கள், உயர் அதிகாரிகள், அரசு சார்பற்ற நிறுவனங்கள், ஐக்கிய நாடுகளின் நிறுவனங்கள் பங்கு பெற்றுள்ளன. இது இலங்கைக்கு கிடைத்த மிகப்பெரிய வாய்ப்பாக கருதப்படுகிறது. ஏனெனில் இந்த மாநாட்டிலே இலங்கை பல வெற்றிகளை, சுகாதாரத்தில் பல வெற்றிகளை அடைந்துள்ளது. அந்த வெற்றிகளை மற்ற நாடுகளுக்கு அறிமுகப்படுத்தக்கூடிய மிகப்பெரிய வாய்ப்பை நாங்கள் பெற்றுள்ளோம். இந்த 2016ஆம் ஆண்டு இதே மாதிரி மாநாடு நடைபெற்றது. இதன் மூலம் இலங்கை பிராந்திய சுகாதார சேவை, இந்த தெற்காசிய பிராந்திய சுகாதார சேவைகளில் ஒரு முன்னுதாரணமான நாடாக காட்டப்படுகிறது. இந்த மாநாட்டிலே பங்களாதேஷ், பூட்டான், வடகொரியா, இந்தியா, மாலத்தீவு, நேபாள், தாய்லாந்து மற்றும் திமோர்-லெஸ்டே நாடுகளின் சுகாதார அமைச்சர்கள் மற்றும் செயலாளர்கள் பங்கேற்றுள்ளார்கள். இந்த மாநாட்டிலே நாங்கள் இதுவரை இந்த தெற்காசிய பிராந்தியத்திலே எடுத்த செயல் திட்டங்கள் பற்றிய மதிப்பாய்வு மற்றும் நிகழ்ச்சி நிரல், அடுத்த 2 வருடத்துக்கான நிகழ்ச்சி நிரல்கள் மற்றும் சுகாதார சேவையின் கொள்கைகள் மற்றும் முன்னுரிமைகள் பற்றி ஆராயப்பட உள்ளன. அதே மாதிரி இது முக்கியமாக இருப்பது 14ஆம் தேதி அக்டோபர் மாதம் மினிஸ்ட்ரியல் ரவுண்ட் டேபிள், அதாவது அமைச்சர்களுக்கு இடையான வட்டமேஜை மாநாடு நடைபெற உள்ளது. உங்களுக்கு எல்லாம் தெரியும், 2035ஆம் வருடம் இலங்கையில் 25% மாணவர்கள் 60 வயதுக்கு மேற்பட்டவர்கள் இருப்பார்கள். அவர்களுக்குரிய தேவைகளை சிறந்த முறையில் கொடுப்பது என்று நாம் இப்போதே திட்டமிட வேண்டும். அதற்கான ஒரு முன் ஏற்பாடாக இந்த வட்டமேஜை மாநாடு நடைபெற உள்ளது. இதே சவால்கள் மற்ற நாடுகளிலும் நடைபெற உள்ளது. இதில் நாங்கள் ஆரம்ப சுகாதார நிலையங்கள், எங்களுடைய ஆரம்ப சுகாதார நிலையங்களை எப்படி இந்த ஆரோக்கியமான முதியோர் மையமாக மாற்றுவது குறித்து ஆராயப்பட உள்ளது. அதே மாதிரி 26, 27 தெற்காசியத்திற்கான உலக சுகாதார தெற்காசியத்திற்கான வரவு செலவு திட்டம் மற்றும் நிலையான வளர்ச்சி இலக்குகள், சுகாதார சேவையில் ஏற்படும் அவசரக்கால நிலைமைகளுக்கான நிதி, நுண்ணுயிர் கிருமிகளின் எதிர்பார்ப்பு மற்றும் புகையை தடுப்பு பற்றி பேசப்பட உள்ளது. ஆகவே இந்த மாநாடு மிக முக்கியமான மாநாடு கருதப்படுகிறது. இந்த மாநாட்டிலே ஏற்படுகின்ற பிரகடனங்கள் அடுத்த வருடம் 2026ஆம் ஆண்டு மே மாதம் வெளிவாவில் நடைபெறும் உலக சுகாதார அமைப்பின் மாநாட்டிலே உள்ளது. நன்றி.
Well, it's my privilege to invite Dr. Farooq Qureshi, that is Secretary to Sri Lanka, to give his statement. Over to you.
Thank you very much. On behalf of the WHO Country Office Sri Lanka, I would like to congratulate and thank the government of Sri Lanka for hosting this regional committee. The 77th session of the WHO Regional Committee for Southeast Asia will be held from 13 to 15 October 2025 in Colombo. In hosting the regional committee this year, the government of Sri Lanka has intensified its commitment towards shared regional health priorities and progress to move ahead for advancing universal health coverage in the region. The WHO Southeast Asia is home to a quarter of the world's population. As Honorable Secretary mentioned, There are 10 countries in this region, and we are expecting the health ministers from these countries coming to Sri Lanka, to Colombo, to deliberate on common health issues of critical concern for this region. This regional committee serves as a vital platform for the member states, for the ministers and their representatives from the member states to come together to deliberate on these pressing health issues, forge collective strategies that address the unique needs of their population. Over the course of the review committee, we expect that the ministers will deliberate on these critical issues, define the solutions that are for the health and well-being of the people in our region, with shared objectives to chart a path that enhances health security, advances universal health coverage, and ensures equitable access to quality health services for all. WHO reaffirms the commitment to the Sustainable Development Goals, the 14th General Program of Work that was agreed upon by the World Health Assembly in May this year, and the reasons for priority in each of the engagements that we have with the member states, and remain steadfast in its support to the member states to collaborate and to act, guided by evidence, driven by equity, and united by purpose. Let us continue to build partnerships across the sector, engage communities, invest in our shared future, and utilize the 78th session of the Regional Committee as ground to reaffirm our regional commitment to serve the people and to improve the health needs of the people. Thank you.
Thank you very much, sir. Now I'd like to invite the Secretary of the Ministry of Health and Mass Media, Dr. Anisha Singh, to deliver a small English briefing.
The World Health Organization geographically divided into 6 regions, and we live in one of them, we call CIO, that is Southeast Asia region. Now, this time, from 13th to 15th October, we will have 78 regional conference of CIO in Colombo. And when it comes to CIO region, we have following countries in the region, that is Bhutan, Bangladesh, Nepal, India, Maldives, and then Thailand, North Korea, as well as China. So this actually amounts to nearly 1/4 of the world population. So though the number of countries is not that many, but the population-wise it's a big chunk. Now we have this WHA, or the World Health Assembly, which takes place annually in Geneva, and the regions conduct regional meetings in preparation to WHA. As well as the regions have their own problems, and the regions have common problems that we share with the world. So in this meeting, the main focus would be the MRT, or the Ministerial Roundtable, where the ministers of these countries confer and take up the pertinent issues in the region. And this time, as the topic of the Ministerial Roundtable, Sri Lanka has chosen healthy aging and primary health care. There's a reason for this, because one thing is, if you take Sri Lanka, by 2041, we will have 1/4 of our population elderly. So we need to prepare for that. And on the other hand, the countries have been talking and working on primary health care because it is through development of primary health care only we could really achieve universal health coverage. Now, the thing is, if you take the health speaker or the popular, the health institutions levels of care as a pyramid, you get bottom, you get primary health care institutions, and then maybe you get secondary health care institutions, and tip of the system or the pyramid is the tertiary care center. So we one would expect people to use more of primary health care, and then when and if necessary go up in the ladder towards tertiary health care. But even in Sri Lanka, if you take, you would see the tertiary care institutions like teaching hospitals, general hospitals, base hospitals are overcrowded, and for that matter, the OPDs, the clinics are overcrowded. Where you can see at the primary health care level, you could see that the utilization is low. But then, when it in terms of the present changes in health transitions, especially in epidemiological transition and demographic transition, the longevity of population goes up, and then with that, the non-communicable diseases are going up. Good old days, we had more infectious diseases. Now we have more non-communicable diseases. So we are actually having a double burden with little twisted towards non-communicable diseases. And here the issue is when it comes to non-communicable diseases, the treatment of non-communicable diseases is very capital intensive. And when it comes to infectious diseases, it is not so capital intensive. For example, treatment of malaria is very less costly. So therefore, we need to strengthen primary health care in preventing, actually in promoting health, in preventing and treating non-communicable diseases, and then prevent the much seeing the overcrowding in the tertiary care. That's the global trend, and of course some countries have achieved. So therefore, this is going to be the main topic, and in the meantime, of course, beyond this ministerial roundtable, we take up for example, program budget, because the region has a program, and we have to review the program, and also there are pertinent regional health problems. We have to discuss about them, and then also overall we have discussed about universal health coverage, which is not so good as we think, maybe due to COVID and then the economic crisis, not only Sri Lanka, other countries as well. And then, of course, there is what we call health emergency fund of the year. So, if you take regions, I'm not talking health region, about health region, but if you take regions of the world, the Asia Pacific region is more vulnerable for disaster. Most disasters are found in Asia Pacific. So that is the reason why we have this fund. So we need to further work out on this fund. And then also we will discuss about antimicrobial resistance. Since the invention of penicillin, which was a remarkable achievement of the mankind, not only in the health, but then later on we found that the antimicrobial antimicrobial resistance is coming up so much so. Now it has become very difficult to produce new molecules of antibiotics. So therefore, we need to combat antimicrobial resistance. The antibiotics are in our bodies, in the animals, and then in meat that we eat, in fruit and vegetable we eat, and on the soil. Because the thing is, we have globally we have been using antibiotics for every day. So unnecessary at unnecessary level. So therefore, we need a dialogue, not only dialogue, but then we need to practice so that the antibiotics are used sparingly and very necessary. So, and also about tobacco control, new products are coming up. So therefore, I think we need to have a modern dialogue as to how to combat tobacco and tobacco products. So those are some of the reasons. And then now after this, the CRO session, there will be evaluation, and also our Honorable Minister of Health and Mass Media will be the chairman of this CRO region for 1 year until next session date.
Thank you, sir. Happy Dr. Shobha Pundari has the Kapusa and Mirashan Hockey, common working members, Denmark and Thailand, President Nilamad is Hockey, the data, the marketing hours for the